ఫ్రెండ్స్, ఈ మధ్యకాలంలో నేను చాలా ATFL టేర్ కేసెస్ చూస్తున్నానండి. సో ఈ పేషెంట్ ఏంటంటే ఆయన ఏజ్ అరౌండ్ 25-26 ఇయర్స్. ఆయన ఒక ఆల్మోస్ట్ 10 days బ్యాక్ స్కిడ్ అయి పడ్డాడు, బ్యాక్ పెంటనర్తో పడ్డారు. సో ఇక్కడ యాంకిల్ దగ్గర సివియర్ పెయిన్ ఉందండి. ఇది లెఫ్ట్ యాంకిల్, నార్మల్ యాంకిల్. ఆయన పడ్డది రైట్ యాంకిల్. చూసారా ఎంత పెయిన్, ఎంత టెండర్నెస్ ఉందో. హీ హెస్ గాట్ సివియర్ పెయిన్ హియర్, okay, at the ATFL area. So nowadays we are seeing more ATFL tear cases. So this is the involved side. So the patient, as of now, he doesn't have any instability. So if the patient doesn't have any instability, then it's a good sign or a good feature. So basically we follow the RICE therapy, that is rest, ice packs, compression, and we ask the patient to keep the limb elevated. So rest, we tell them to not to do any running, jumping, jogging for at least 3 weeks. Ice packs to apply morning and evening for at least 10 minutes 2 times a day, so that it causes vasoconstriction, thereby the swelling to come down, vapu taggutadi. And compression, we give a crepe bandage, swelling tagginchadaniki. Then we ask the patient to keep the limb elevated, to keep over 1 or 2 pillows. So idi friends, so if the patient has persistent pain, if the patient has instability, if the patient has difficulty in walking, in addition with the X-ray, we ask for an MRI scan, so to see if there is any other associated injuries, like sometimes there can be talus osteochondral injury, so sometimes there can be a complete ATFL tear. So to see for other injuries, we ask for an MRI scan if the patient doesn't have any relief for 1-2 weeks. So if you have any doubts about ATFL tear, you can ask in the comment section below.